Unboxing of the new OverStitch NXT Endoscopic Suturing System. Carefully take out of the sealed packaging. To remove from the backer card, you'll start with the tabs by the distal tip and then work your way up the shaft of the device. Remove the handle next. Next, we'll remove the anchor exchange portion by moving the tabs out of the way. Finally, there are two tape applicators along with two additional tape spools that'll come out. The applicators are preloaded with tape, and then the spools would be extra for either remounting or repositioning the device. Backer card can be disposed of at this time.
The first thing you're going to do is going to grab your needle driver handle,
Okay.
and this little C cup here is going to, the opening is going to face away from you, okay. And you're going to start on the channel neck here and just slide it up. Right. So these biopsy caps line up with your scope channel. Just like that. Yep. And then you're going to use that blue strap that you may be familiar with, loop it around the biopsy channel and right onto this peg down here.
I see there's two holes here. Does it matter which holes?
Whichever one makes it more secure. Now we're actually going to switch ends and we're going to do the Endcap. So one thing you can kind of do is kind of line your scope up with the sheath here as you go down, just so you kind of know how it's going to lay out. Okay. So let's first close your needle driver handle, and that'll just make it easier to secure the Endcap here. Okay. So the first thing I'll call your attention to is there's a little half moon white indicator on the tip of the Endcap. That's your alignment marker, and that's going to line up with your scope channel. So wherever that half moon is, if this is your scope channel, your half moon is going to align right next to that. Got it. So that's going to make sure you're in the right position for the Endcap. Okay. So as you insert the scope tip into the cap, you're going to push up, in and up, and then there's a little shelf there that'll make sure you're firmly in there. Yep, I felt that kind of seat. And then you're going to make sure that white half moon is oriented just to the side of your scope channel. All right, good. Now holding that with your left hand, because it's not secure yet, we're going to take these tape spools, and there's little white end loops here. Mm-hmm. You're going to hook those onto we're going to start with the distal hook first, and you're going to hold, and you're going to do kind of a crank motion with your hand. Don't actually turn the tape handle itself, because you want the tape to apply. You're going to keep going all the way until the tape runs out. Okay. All right, so go ahead and do that. Keep firm pressure as you go around, making sure there's no gaps. The other thing to be mindful of, just like that, and then you can just push that tail down. The other thing to keep in mind as you're taping is not to overlap the second hook, since we have another tape applicator for that. Okay, so stay in the plane, don't go correct, sideways. Yes, correct. And go ahead and tape the other one. Again, same pressure, crank motion.
Are both tapes needed? Is one enough?
So both tapes are needed and are recommended. If you do happen to make a mistake, or if something doesn't tape right or there's gaps, there are two additional tape spools in the packaging. Okay. And they're simply just twist off the end and you put the new one on by twisting it back on. So if one of them drops or comes off incidentally, you're able to still secure
And
the
the
device.
extras come with the device.
Yes,
Awesome.
they're in the package. All right, so next we're going to attach the sheath. Okay. So we'll make sure there's kind of a concave opening there, so you just lay the sheath into, or the scope into.
Yeah, that's intuitive. It wants to fall into that slot.
All right, and then we're going to start distal and work proximal.
Okay.
So all you're going to do is pull one of these white tabs, and kind of the same motion as you did with the Endcap, just pull the tape around the scope firmly so it has a good seal, and the tab should just come right off like that.
Oh, okay.
All right. Same thing with the other two. There we go. This part will be much more familiar to you. Obviously, we have our 2-0 suture. Actually, there's a cup of water there that I conveniently placed. We'll dunk that. And again, your techs know this, but just for sake of repeating, insert your anchor exchange, pull out, and then holding the suture, pull it off the backer card. Nice and easy. There we go. All right, so your anchor exchange and suture, these are going to load on your outermost scope channel.
Okay.
So make sure that biopsy cap is open, otherwise you're going to meet a lot of resistance. And then just go ahead and fly that down.
So kind of like my dual channel scope, it's the right side is the bigger of the channels.
Correct, yes.
Prior to inserting the scope in the device, we're going to ensure that the handle is closed. All right, so you're going to insert the scope and the NXT device. Prior to inserting the scope in the device, we're going to ensure that the handle is closed. So you're going to insert the scope and the NXT device. To the treatment site. With the device in the patient, open your handle. And the first thing we're going to do is create suture slack. So we'll advance our anchor exchange and anchor. And then pull back to create a small suture loop. Then we'll close the handle. Advance the anchor exchange with the anchor loaded until you feel it click onto the needle body. Then to release the anchor from the anchor exchange, we're going to press the blue button and pull back 1 centimeter. And when we open our handle, now we're in the loaded position and ready to pass our first suture.
MaxFlex Advanced Retroflexion should only be used on Olympus and Fuji compatible scopes with Endcap mounted as instructed to ensure added articulation is only in the scope's primary up direction. Step 1. To do this, you would need to fully articulate the scope using primary up dial and hold dial to maintain this position. Do not lock the scope wheel. Step 2. Keep the suture in your primary channel out of the way by holding it in your scope hand. Step 3. Disengage the blue MaxFlex pull string pill from the underside of the device handle. Step 4. Pull string straight out from device to increase articulation to desired position. Step 5. Wrap pull string around orange brake washer on side of device a minimum of 2 times to secure device position. Step 6. Once MaxFlex use is complete, hold endoscope up dial at its fully articulated position and then release pull string by unwrapping from brake washer and releasing the tension in the string. Do not yet release hold on endoscope's up dial. Step 7. Secure blue pull string pill on the underside of the device handle while ensuring the pull string does not wrap around handle. Step 8. You may now release the scope dial from the up position.
Open our handle. Now we're in the loaded position and ready to pass our first suture. You're going to advance your Tissue Helix Pro and applying forward pressure, begin to turn the helix into the tissue. So then we'll pull the tissue into the center of the tower, and we'll secure the Tissue Helix Pro in the left hand, and then close our handle to advance the anchor through the tissue, pierce the tissue past the first suture. Then we advance our anchor exchange, fill it and engage the needle body. This is a very tactile feel, and then pull back about 1 centimeter to pull it off of the needle body. Then we'll open our handle to release the needle body, extend our tissue helix to give us a clear view of the suture being passed, unscrew our helix and pull it back into the device. As you can see, the suture is passed. It's originating and converging from the alignment tube at the bottom of the screen. At the end of your construct, once you're complete and Tissue Helix Pro has been disengaged, we're going to advance our anchor exchange, pass the alignment tube. We're going to press the blue button. That's going to release the anchor, create the T-tag. We're going to remove our anchor exchange. When loading the cinch, it's helpful to secure the handle. The PK allow you to use both hands. We're going to thread the end of the suture a couple of centimeters into the loading loop. Then we're going to pull with the gold tab in line with the catheter and thread the suture. As an assistant, I'm going to hold tension on the suture while I'm passing it to the physician. The physician's going to advance the cinch down the device channel. Then I'll hand the suture to the physician so that he has full control. Endoscopically, the cinch is going to go to the position of the first suture passing. So we're going to advance it, and we're going to place the cinch on top of the tissue. So it's helpful during the tensioning process to pin the handle of the scope to the physician's chest, cradling it with their left arm so they can secure the suture with the left hand and the catheter of the cinch with the right hand. Then slowly start to pull tension. This will be done in increments with slight moments of rest in between as to not break the suture. You want to have the catheter of the cinch at a distance. Once the physician is comfortable with tension, then as an assistant, I'm going to release the safety, the cinch safety. I'm going to open my hand, and that'll release the safety. Then I'm slowly, with two hands, going to close. Meanwhile, I'm watching the physician's hands. Once they release, then I'm done deploying the cinch.
You disassemble the NXT device. Start by removing your anchor exchange and your tissue helix. When removing the device, it's important to cut the tape within the groove of the end cap here so as not to damage the scope. You can use either a scalpel or a surgical scissor to cut the tape here. There. Once you've cut the tape, you can then peel it back opposite direction that you wound the tape. The other option, once you've cut the tape, you can just break the end cap off of the scope as the hooks will just bend off. Once your end cap is disengaged, you're actually going to then travel back up towards the top of the scope. Each of the sheath tapes are perforated, so all one has to do is separate the scope and the sheath and pull apart. Work your way down proximal to distal. Your device should come free. Last step, back at the handle, move your blue strap back over, and then pull the handle down and off the device.